Hi, it's Dr. Morazy with Minutes for Moms, here to give you more practical pediatric advice. Today we are going to talk about a diaper rash. Diaper rashes are very common those first couple years of life because these children are still in diapers. So the number one goal when it comes to treating a diaper rash is you need to use a barrier. And what I mean by a barrier is something that actually kind of goes over top of that skin and can help protect it from the acidity of the urine or the stool. So when you're looking at your active ingredient in a diaper rash ointment or cream that you use, you want to have something that has zinc oxide. And zinc oxide concentration can go up from 10 up to 40%. And you just want to make sure that you reapply it quite frequently. A common rash that I can see in our newborns, that's going to be the first couple weeks of life. They can have a very red, kind of broken open skin rash. That's that jaundice, that bilirubin number. As they poop it off, it is very irritating to the skin and actually can leave open sores. So the number one treatment for that is using a barrier. Another common rash that we can see is a rash secondary to a fungal infection, and from a fungus standpoint, that is a germ that is really ubiquitous. It's found anywhere, but it really likes warm, moist areas, and that's the reason why we will commonly see it in the diaper area. The way you know that you're dealing with a fungal diaper rash is it's really typically a very fire engine red. It starts out small and then it slowly kind of spreads, and as it spreads, it throws out what we call little satellite lesions. So you'll have that rash, and you'll see little boop, 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 red polka dots that kind of spread up there, and then the next day it's spreading higher and higher. If that's something that you see, you definitely want to use an antifungal cream. A common ingredient in an antifungal cream is clotrimazole. What you do is you want to apply that several times during the day, and you will notice a marked improvement within probably 2 to 3 days after you starting treatment. Another common rash that I can see is right around that 1-year-old birthday. It's secondary to those 1-year-old molars coming in. And more often than not, people will complain that the sores are open and they're red and some are bleeding and very irritating to touch. So what you do there is you're going to get your diaper wipes, you're going to rinse them off with water so you're getting all that chemical off. You're going to gently wipe that stool away and the urine away, and then you're going to apply either your zinc-based ointment. You can also use Aquaphor, which is a medicated Vaseline-based ointment. Another ointment that is available out there is something called Chamoceptine, and that is something that really works well when you're dealing with an acidic medium. So usually I'll tell people you can order that, or you can ask the pharmacist to order that, and that is something that you're going to apply 3, 4, 5 times throughout that day. Until those molars come in, that rash is going to be fairly difficult to control. But know very well that once those molars are in, that rash will just really magically disappear. So those are really kind of the basics of diaper rash creams and diaper rash ointments. So hopefully that gave you nice practical pediatric advice. Once again, I'm Dr. Morazy with Minutes for Mom. Now you know what I know. Until next time, thanks.